Welcome to this program today that I want to introduce you to something very interesting for your health and for your life. I want to talk about lifestyle diseases. You must have heard about lifestyle diseases. That is diseases which come from the way we live our lives. And there are several of them, and I'm going to be dealing with each one of them here continuously until I have covered over all of them. I am going to be talking to you about them, and I'm going to tell you what the disease is, the causes of that disease, the symptoms of that disease, and also the management of that disease. And mostly the management I'm going to be talking about are going to be dietary management of that particular lifestyle diseases. And I wanted to say a disclaimer straight away from the beginning. My names are Dr. Alfred Ogao. Alfred Doki Ogao. That's my name. I am a biochemistry. I teach biochemistry. I have a PhD in biochemistry. I have a master's degree in medical biochemistry, and I have a PhD in biochemistry. And therefore, I teach biochemistry at Karatina University. And because of my knowledge of biochemistry, and most of these lifestyle diseases come from biochemical and also metabolic disorders that take place when we have eaten food, and there is where these diseases come from. I have decided to come out public and advise people on these diseases because they are mostly emanate from the foods that we eat, emanate from the lifestyles that we eat. So my disclaimer is that I am not a medical doctor. I only have a PhD in biochemistry, and I also master medical biochemistry. And in biochemistry, which is my medical biochemistry, we normally deal with the diseases. So we want to know how diseases start, or they begin, or the cause of the disease. We want to know how it progresses, that is the etiology, how the disease progresses in the body, and also how it ends when there's intervention, by medical intervention. Maybe you get treated and you're given medicine, and then the disease is cured and it goes out. Or tragically, if it comes to a point where maybe somebody will lose a life. And that could happen whenever somebody has got that kind of disease. And so this is what I'm talking about. So I am not a medical doctor, but I'm going to recommend dietary. That is the nutritional way of handling these diseases. And that's what we are going to be talking about on this particular platform. So I want to welcome you. If you have a friend or a relative or somebody who is suffering from diabetes, cardiovascular heart diseases, high blood pressure, and many of those that are even obese, and also arthritis, these are normally the lifestyle diseases that I will be talking about on this channel. And I want to advise you on the dietary way or nutritional way of handling these diseases for your good health. So what are lifestyle diseases? Lifestyle diseases, which are also known as non-communicable diseases, or NCDs, are health conditions primarily caused by unhealthy lifestyle choices, and also causes caused by environmental factors and genetic predisposition. So as you can see, lifestyle diseases are caused by unhealthy lifestyle. And we are going to explain what unhealthy lifestyles are. And we make those choices very early in our lives. And also they can be caused by environmental factors and also genetic predisposition. Unhealthy lifestyles are like, for example, you engage yourself in eating sugary kind of foods, alcohol, and you end up with smoking, and many of these, as we are going to be explaining each one of them, as they are caused from our lifestyle. And therefore, I want to start by discussing one of those diseases, which is the most commonest of all. It's very common. And this one is what we want to discuss right now, so that you can be able to understand what it is and how to deal with it. And I believe that by the time when we have discussed all this, you'll be able to understand how to manage that particular disease. And we start off straight away with one of them, as I have said, and that disease we are going to be talking about right now is actually what is called diabetes. Diabetes, and many people know about diabetes, but many people do not know the details about this disease we call diabetes. We have diabetes type 1, which is insulin caused, because the body is not able to produce insulin, and because maybe the pancreas, where the insulin is produced, the cells of the beta cells of Iles of Langerhans have been destroyed by some forces in the body. And therefore, insulin is not being produced, and it is insulin that actually activates or makes sure that after you have eaten, the sugar or the glucose that comes from the food, especially if you have taken carbohydrates, the insulin ensures that glucose is facilitated into and enters into cells, the liver and adipose tissues, and stored up as a glycogen, which can be reverted back to glucose if the body needs energy. So I have described type 1, and now let's go deep into type 2 diabetes, because that's our main topic for today. Type 2 diabetes is a chronic disorder, is a chronic metabolic disorder which is characterized by high blood sugar levels, which we call glycemia, and that resulting from the body's ineffective use of insulin or insufficient production of insulin. So in type 2, there is insulin but not enough, or there is also the insulin resistance. Insulin is a hormone produced by pancreas, and it helps regulate blood sugar by facilitating the uptake of glucose from the bloodstream into cells to be used for energy. So once glucose is around, it can be able to go through metabolic processes, and we end up with energy, and that energy is in terms of ATP, adenosine triphosphate, and that the energy we require for our body, for us to walk, to work, and to do a lot of things. That energy is required. When it is too much in the blood system, it must be taken into liver cells and into adipose tissues. Naturally, if somebody doesn't have diabetes, it happens like that, but they have a lot of insulin around. But for the diabetes too, because there's not enough insulin, then you end up with a problem of having too much glucose concentration in the blood, and when it is there, it causes problem. In type 2 diabetes, the body becomes resistant to the effects of insulin, and the pancreas fails to produce enough insulin to maintain normal blood sugar levels. So this leads to an accumulation of glucose in the bloodstream, which can cause various complications over time if left untreated. So that means that when somebody suspects that he or she has diabetes, they must go for quick checkup with a medical doctor in the hospital. Risk factors for type 2 diabetes includes obesity. That is when you put on too much weight, when the weight's coming on every now and then and you become overweight, then you are a candidate of diabetes 2. You can also be a candidate for diabetes 2 when you are physically inactive. In other words, you don't walk around, you don't run, you don't practice, you lead a sedentary type of life. And then number 3, the crown of it all, unhealthy diet. So when you're having an unhealthy diet, you are a very good candidate for diabetes 2. And also the other thing we have noted is that the family history of diabetes, maybe your grandmother, your grandfather, or your father, your mom, or your sisters and brothers, they have suffered diabetes. There is very high likelihood that you may suffer the same. Ethnicity is also a factor to be considered. And also, so ethnicities like maybe it likes some kind of ratio or tribes, it's very prevalent, and in others it is not very prevalent. So let me give you the symptoms of type 2 diabetes, which if this happens to you or your friend, then you know diabetes is knocking on their door. Number 1, increased thirst and urination. So when you frequented the toilets and there's urinating every now and then you feel excessive thirst, and you take in a lot of water. You take in a lot, and the more water you take, the more thirsty you feel. And then you urinate a lot. So what is happening here is the thirst is that the brain is getting the feedback mechanism that there is a lot of some chemical in the blood system. That is the glucose. And therefore you need to have more water to come so that it can go through the kidneys and be taken out through urine. So that what the body is struggling with, and that's why you take too much water in through thirst and then you urinate a lot, and that's what's happening. So that one sign that you may be having diabetes, that's symptom. And symptom number 2 is fatigue. If you have done some little work, you just feel tired, you just feel fatigued. Even from sleeping, you just feel fatigued. And all the time you are just tired here and there, you want to sleep and things like that. That's another sign that you may be having diabetes. And sign number 3 is blurred vision. When you look at things, especially letters, they somehow get like doubled up, so they are not very clearly spelled out, and also can see them very clearly. So you have what you call a blurred vision. A blurred, not blood, but a blurred vision. A vision that is not very clear. Also the 4th symptom is slow wound healing. When you get injured, it takes a lot of time for you to be healed, that particular wound. And when it takes time like that, then there's a possibility that you may be having that kind diabetes is knocking on the door. And then the number 5 is tingling or numbness in the hands or feet. So when you feel numbness in the heart and in the hands and also the feet, and you have some tingling in the feet especially, some kind of pain just comes up in the feet and tingling like that, and you feel that pain and you feel, oh boy, you feel like scratching like that. That is also another sign of type 2. And then number 6 is recurrent infections, particularly in the skin, the mouth gums, or urinary tract. So this recurrent kind of skin disease and also the gums of the teeth and all that could also spell that maybe you may be having some diabetes. Those are the signs or the symptoms of diabetes type 2. So the other thing which I want to say is that type 2 diabetes can often be managed through lifestyle modifications, such as adopting a healthy diet. So when you realize, for example, if it has been diagnosed that you have diabetes, then you will have to modify your lifestyle. You will have to modify it. And at this time I want to say that I have written a book which is now available to all of you, and it's simply called Dietary Management of Diabetes. Dietary Management of Diabetes. And that book will tell you what type of food you should eat, how you can adapt to a modern type of life that you can manage your diabetes without much problems. You also need to engage in regular physical activity and achieving and maintaining healthy weight. You have to reduce your weight. Don't eat too much food and put on weight and put on weight. Avoid putting on weight. And monitor blood sugar levels or blood glucose levels. In some cases, oral modification or oral medications or insulin therapy may be prescribed to help control blood sugar levels. And that means I want to emphasize that you need to visit a medical doctor who will be able to test and be able to prescribe proper medications for you to start controlling the sugar levels in the blood while we put you onto dietary management of diabetes. If not controlled, if type 2 diabetes is not controlled, complications may lead and may come on in your life. And these complications could be heart disease, can be stroke, can be kidney disease, it can be nerve damage, which is neuropathy. It can also be eye damage, retinopathy, and it can also bring foot problems and skin conditions. Foot problems could be like, for example, if it's uncontrolled and it is always in 15 millimole per DL all the time, then you end up with a serious problem, and even amputation could be recommended because your legs will not be moving around and the things could be very, very bad. So the key here is to control. Therefore, it is essential for individuals with type 2 diabetes to work closely with healthcare providers to manage their conditions and reduce the risk of complications through regular monitoring, medication adherence, and lifestyle adjustments, which is actually dietary control or dietary management of your diabetes. So now we come to deal with the causes. What are the causes for diabetes 2? And the mother of all, or the queen of all, cause number 1 is unhealthy diet, which is high in sugar and refined carbohydrates, sugary foods. When you put sugar in the tea, you put a lot of it. Sugary foods and refined carbohydrates are like number one, maize flour. That's dangerous. Number one, shifted maize flour. Number one, shifted wheat flour, and all those and other refined carbohydrates. Those are dangerous and they cause diabetes. Number two, a sedentary lifestyle. As a lifestyle that you just sit in one place, or you don't walk, you sleep around, and you keep on adding weight, sedentary, and everything is done for you. You don't cook, you don't walk around. Even the only thing you do for yourself is maybe go to the toilet for maybe a short call or long call, and maybe bath yourself. But the rest of the things are done for you. That's dangerous. That's what you call sedentary type of lifestyle. Avoid that one. Number three, obesity or being overweight. When you put on a lot of weight, it could cause diabetes in you. So overweight is a candidate for developing diabetes too. Number four is genetics. It could run in the family. As I've said earlier, if your grandfather, your mother, your sisters, your brothers have suffered from diabetes, then there's likelihood that it also could be having some genetic connotation into it. And then number 6 is insulin resistance. When you have insulin resistance, and I'm going to explain this later on, what insulin resistance is all about. But for now, you just know that it's insulin resistant, and because of that, it is not able to facilitate the glucose to enter into cells and the liver cells. And of course, I mentioned earlier, also ethnicity. Some groups are more predisposed to developing diabetes too than others. So those are the causes of diabetes too. And I want to go straight and also now give you how you can be able to have your dietary or eating, how you can have healthy eating program to manage diabetes. And that's very important. In all the lifestyle disease that we have talked about, actually having eating healthy or healthy eating will help you to manage the diabetes and lead a normal life. So what are the healthy eating program for type 2 diabetes? Number 1, emphasize portion control and balanced meals to manage blood sugar levels in your body. When you eat maize meal, it should be small portions. And then proteins also bigger than the carbohydrates or the maize meal. And vegetables should be taking the half of it. So when you divide the plate into 4 portions, you cut across like that, you have the half of the plate should be having vegetables. Then the remaining half you divide it into 2. 1/2, 1/4 maize meal, and then quarter proteins if they are there. And that's what you should do. So that's what we call portion control. And number 2, choose complex carbohydrates with a low glycemic index, such as whole grains, legumes, and non-starchy vegetables. In my book, Dietary Management of Diabetes, I have given you every type of food you need to control and manage your diabetes. Even I am going to suggest in the future programs that I'm going to be recording on YouTube how you can be able to ferment some of the cereals that we have, and you can have very low glucose in the blood. So you'd have to choose complex carbohydrates. Do not eat refined carbohydrates. Number 3, include lean proteins, healthy fats, and fiber-rich foods in each meal to promote satiety and also stabilize blood sugar. Lean meat proteins, we mean maybe taking things like chicken meat. If you have to take meat, take chicken meat, and take fish. A lot of fish, all types of fish are okay. Whatever type it is okay. And then fats, please do not use saturated fats, but use unsaturated fat. Now, saturated fats are animal-based, while unsaturated fats are plant-based. And that means do not eat, avoid red meat as much as possible. If you have to eat it, very little portions and not frequently. In a week, maybe once, that will be okay, or twice, if you can't help it, but not too much of it. And because red meat brings about saturated fats, which is very unhealthy. And if you frying, when you fry, try to use a plant-based. And this details of plant-based is in my book, Dietary Management of Diabetes. You can, when you purchase, you'll be able to see what I mean by that. And then also fiber-rich foods like the vegetables and other. In other words, eat food with husks. Don't always peel and remove off. So do that, and you'll be able to control your diabetes very, very well. Number 4, limit intake of sugary foods, refined carbohydrates, and processed snacks. You've got to do that to avoid, so you can monitor and manage your diabetes. Number 5, monitor carbohydrates intake and spread them evenly throughout the day. In fact, the enemy, I will tell you, enemy number 1 to diabetes 2 and any other diabetes type 1, the enemy number 1 is carbohydrates. If you can only be able to be careful about carbohydrates, especially refined carbohydrates like white bread, and there's another bread which is they are calling brown bread. Don't go for that. If you're diabetic, please go for the wholemeal bread. Wholemeal bread is much better. And in future videos, I will explain how you can be able to treat such foodstuffs, carbohydrates, and ferment them and end up with very, very healthy type of food for diabetes. Number 6 or number 7, aim for consistent and meal times to help regulate blood sugar levels. That means you should have your breakfast with wholemeal bread in the morning. Tea with milk is okay. There's no problem with that. You can take that. You can take green tea. You can take whatever tea or black tea or whatever. That's no problem. But even if you take it with milk, no problem. That's okay. And at the same time, what you should do is that if you take breakfast at 7 or at 8, whatever time it is, make sure at 10 you take some snacks. Lunch, take your lunch regularly, and also at 4 take some snacks, and at in the evening, maybe at 7, take your supper and sleep. And in my book, I have explained all that. What you should take at breakfast, what you should take at lunchtime, what you should take at all those snacks. I have indicated them, and even in the evening, your supper, I have indicated that Monday to Sunday. So you have no problem. Just get hold of that book. Call me at the end of this video. There's my contacts that you'll be able to call me and contact me, maybe for yourself, if you're suffering yourself, or your friend, or a relative, your mom or your dad or somebody like that. Call me and I'll be able to give you instructions of how you can get that book, which explains everything to you. And please subscribe to this channel, and like it and share with your friends and others, and like it at the same time. so that when I produce another video, which I'll be doing on a weekly basis, watch out for a video on these lifestyle diseases. They will be coming your way. So subscribe for you to know when I have produced one. And lastly, number 7, consider consulting with a registered dietitian to develop a personalized meal plan based on individual needs and blood sugar management goals. I'll also add, regularly visit your doctor to monitor your conditions, your diabetes condition. So visiting your doctor to monitor your conditions, visiting a dietitian, and with my book, you'll be helped to be able to manage your dietary conditions, and you'll be able to eat healthy. And when you eat healthy, I can assure you, diabetes will not hinder you to lead a normal life. You can lead your normal life, and diabetes should not kill you. No, you should not die from diabetes. No, you live long life the way the Lord God Almighty has set your timing very well, and you'll be glad and die naturally at the right time if you manage your diabetes using the diet that I'm suggesting in my book.